And that's your leg drop as far. That's it?
Yep, yep.
Okay, good. Let's have a look. $78. Okay, relax there. How much can you just let the hip drop totally?
Yep.
That's it?
Yep.
Okay, keep it there. $15 FFD. This works there. Come this side a bit and just show it from this angle. Good. And it hurts when it's touch everywhere, is it right?
It's when you play around the patella, yeah.
Patella,
Yeah.
measure the patella.
Yeah.
But does it hurt on the sides here?
Yeah, it hurts in there sometimes. Not today, but it does hurt in there sometimes.
Can I get you to get up and walk for me, please?
Sure.
Mark? Can you take this again? Okay, come and stand here, Michael. Face the wall. Just standing. Turn around, face the wall. That's it, okay. And try to straighten your leg as far back as you can go.
That's it.
Until you can go.
Yep.
Turn around, face me now. Okay, and this one, as far back as you can go. Good. Alright. Good. Have a seat. So this is the same patient that we showed you the video of earlier, and this is now 6 weeks following the operation. At the time of operation, what we did was we removed the previous prosthesis and we distalized the joint line by augmenting distally and posteriorly, and the big thing we did was to proximalize the tibial tuberosity. So you'll see an extra at the end of this of the 6 week post-op, and here's the patient who is 6 weeks post-op. Can you please bend your knee? Okay, and we have a range of motion of 100 degrees, and before the operation it was 70 degrees, and he doesn't have an FFD anymore, and he's nice and fit. Just relax your leg totally, good, and hold your leg up you go, and it's got a slight extensor lag, but over time that should recover as well.